Hello, I'm Chris Pruitt. I am a cataract and glaucoma specialist with the eye surgeons. The purpose of this video is to talk about a specific type of glaucoma called angle closure glaucoma and how we can initially treat that once you're diagnosed with it. So to recap, glaucoma is damage to the optic nerve, which is the connection between the eye and the brain. And that damage is caused by the eye pressure being too high. So the treatment for glaucoma is to lower the eye pressure and stop the damage to the optic nerve from continuing to occur. Inside the eye, there's a faucet in the drain. So if we rotate this eye to look upwards, and if we focus on this portion of the eye right here, we're going to enlarge this. Good. So this area of the eye right here is the faucet. Fluid is produced in the faucet and it comes this way over the lens, behind the iris, and through the pupil, and then over this direction to the drain of the eye. Now, unfortunately, for some people, the iris is very close to the cornea and can cover up the drain. We call that angle, because this is an angle, call that angle closure glaucoma. So, glaucoma treatment involves lowering the eye pressure. If the drain is covered by the iris, we need to move the iris. There are two ways to do this: laser peripheral iridotomy, or a small laser, or by lens replacement, which is known as clear lens extraction or cataract surgery. One way to move the iris is to perform a small laser called a laser peripheral iridotomy. We do this by taking a laser and putting a small hole in the iris. This allows fluid to move from the faucet through the hole to the drain, and it allows the iris to relax and fall backwards, opening up the drain of the angle more. This is what it looks like in a patient. Again, you can see that this is the pupil, this is the patient looking at you, and here is a hole in the iris that we have placed with a laser. Another way to move the iris is to perform cataract surgery or clear lens exchange. This image is of a patient before and after cataract surgery. Here you can see that the cornea and the iris are very close to each other. That angle is narrow. And this is the patient's normal lens. This is where you can get a cataract as you age. And this is the patient after this lens is taken out and a plastic thin lens is placed in place. Here you can see the incision that the surgeon made into the eye to remove the cataract and put the new lens in. And you can see that this angle is much larger now. The iris is no longer bowed forward. It's very flat and far away from the drain of the eye. This is what an eye looks like before cataract surgery. There's a clear lens in its place. We remove that lens and we put in an artificial lens in its place, which is very thin and very clear. So which of these two interventions is best for the initial management of angle closure glaucoma? Is it the small laser or the laser peripheral iridotomy? Or is it the cataract surgery, also known as clear lens extraction? Well, fortunately, we have a randomized controlled trial to look at this. This study is called the Effectiveness of Early Lens Extraction for the Treatment of Primary Angle Closure Glaucoma, also known as the Eagle trial. I'll have a link to this in the description. The Eagle trial found that primary cataract surgery or clear lens extraction was better than laser peripheral iridotomy. Primary clear lens extraction resulted in a higher quality of life, lower glasses prescription because at the time of cataract surgery we can put most of the glasses prescription inside the eye, and better vision even with glasses on. It also resulted in a lower eye pressure. It resulted in patients needing to use fewer eye drops to achieve that pressure. There was a much greater chance of being drop free. So 60% of patients that underwent the clear lens extraction were not needing to use drops at the end of the study versus 21%. That means that almost 80%, almost 4 out of 5 people that had a laser peripheral iridotomy needed some kind of eye drops after the surgery. Also, patients that underwent clear lens extraction were less likely to have a problem with eye drops at the end of the trial. Most importantly for me, undergoing clear lens extraction before laser peripheral iridotomy resulted in fewer trabeculectomies and tube shunts. Trabeculectomies and tube shunts are very aggressive glaucoma surgeries where we're basically making a hole in the eye to allow fluid to drain from the inside of the eye into the eye socket. These are very risky surgeries, and I think that it's a very good idea to decrease your risk of having these surgeries in the future. There are some risks of clear lens extraction. The first of these is the same set of risks that is involved with cataract surgery. I have another video detailing this that you can look at. This will be linked in the description of this video. Most importantly, there's an increased risk of dissatisfaction as compared to standard cataract surgery. When we're talking about doing clear lens extraction, we're not trying to improve the vision so much. What we're really trying to do is improve the long-term outlook for the eye. We're trying to decrease the likelihood of you losing vision to glaucoma, decrease the number of eye drops that you need to use every day, and decrease the risk that I or someone else will need to do a major glaucoma surgery for you in the future. So that's a very different set of expectations than the patients that are coming in with very blurry vision due to cataract and are very happy after cataract surgery. So if you're aware of this and if you can prepare yourself mentally for that, that tends to mitigate that increased risk of dissatisfaction afterwards. That's all I have for you today. Thank you very much for watching. Thank you for learning with me. Thank you for letting me take care of you. If you have any questions, please feel free to reach out to our office. Thank you.